turning things over now to Dr. Ann Sales, who's going to be talking to us about patient and urologist perspectives that we've gleaned from the trial thus far. So thank you, Ann.
Thanks, Dr. Dow. I'm Ann Sales. I'm a faculty member at the University of Missouri in the schools of nursing and medicine. And the work I've been doing related to the SOUL trial is qualitative interviews with both surgeons and patients, in which we've been talking about their experiences and some of the issues and factors surrounding decision-making. This is titled A Necessary Evil versus Only If There's No Alternative, which represents the predominant view coming from surgeons that stent use is a necessary evil in routine ureteroscopy, and patient views that they would, in general, prefer to have stents used only if there is no alternative to using the stent. I'd like to briefly thank the team that's been working with me on this. These are all graduate students and graduates of this PhD program at the School of Nursing at the University of Missouri: Krista Teresi, Cassandra Bocciarino, Brittany Marks, and then myself. So what we've been doing is conducting interviews with surgeons and patients about their routine ureteroscopy, their experiences, and the use of stents. We've completed 29 interviews with surgeons. We are continuing our analysis with surgeons. And our goal has been to interview all the surgeons who are participating in the SOUL Music trial. Among patients, we've completed 20 interviews. We have completed our analyses of those interviews. And our goal is to interview patients, because that's well over 500 at this point. But instead, a sample of patients who underwent ureteroscopy and consented to participate in the trial. We're also conducting a survey of all patients enrolled in the trial, and that survey is currently underway. So let me talk briefly about the themes that have emerged from the interviews. On the side of surgeons, where we've mostly asked them to reflect on the factors that affect their decisions about using a stent, we have heard repeatedly that stents are regarded as a necessary evil. As they present the plan for surgery and for the procedure to patients, they focus on managing expectations. And the majority of surgeons participating in the trial say that they stent between 70 and 90% of all patients undergoing ureteroscopy. We have interviewed a couple of surgeons who are low outliers, who say that they only stent about 10 to 20%. The issue that surgeons have reflected on repeatedly in their interviews with us is that they don't know what they'll encounter during the procedure, and that they have, in general, significant anxiety about potential poor outcomes if they don't use a stent. On the side of the patients, as we've interviewed them, most, not all, but most have expressed a very strong preference for avoiding a stent, only if there is absolutely no alternative. And for most of them, the major issue is pain. In addition, they've discussed the need for more education and preparation than they feel that they've received. Many of them seek information from the internet, from friends and family, but also from their own previous experiences. And most have very strong preferences about stent removal, as well as whether or not they receive a stent. Most patients have expressed that they did not feel that they got enough information about stent removal. One of the things I want to stress, though, is that most patients in this trial were willing to accept randomization, and this is mostly out of a desire to help future patients. So to summarize, this is a very brief overview of what we've been learning from our interviews. Both patients and surgeons see the experience of ureteroscopy very differently. Surgeons focus on the technical issues, and patients focus on the pain that they experience. It is a painful procedure, and they're in pain while they have kidney stones. Most surgeons know that their patients would prefer not to have a stent, but they feel that circumstances during the procedure require it. And most surgeons focus on managing expectations. They also express a concern that predicting whether a procedure will in fact be routine when it should have been routine is not easy. And these are issues that we will continue to consider and reflect on as the trial continues and as we begin to look at the preliminary results.